Hello, my name is Katrina Harvey. I am a certified medical assistant. I went to Baker College to earn my associate's degree in applied science. And I got my certification from taking a test from the AAMA. And they require me to have 60 CEUs every 5 years. So that means that I need to have CEUs every year that I add to my total. So I continuously do different classes on the weekends to add to my CEUs. I did my first job would have been my externship, which was at a primary care office. I worked there for 60 days, 90 days, I can't remember. I think it was 90 days, so that I learned everything and tried everything that I learned in school. And then after I was done there, I graduated from Baker and then continued to look for a job. And then I got a job at a gynecologist OB office where I worked for 2 years. They made some choices, so then they decided they were no longer going to deliver babies. So I decided I'd look for a job because that kind of scared me. So then I decided to find a new job. So I found another job at an OB office, which was with the Bronson Hospital. I worked for them for 2.5 years and decided to venture out into something different and went to orthopedics. Orthopedics was not my favorite. It was the longest 6 months of my life. And then I went to the job that I have now, which is Bronson Center for Women. At this office, we do mammograms, ultrasounds, and breast biopsies. I am the person who sets up the tray for the doctor who is going to do the biopsy. So I draw up lidocaine. I get everything around that the doctor is going to need to be able to do the biopsy. Once the biopsy has started, I am the one that talks with the patient throughout the whole biopsy to keep them occupied or distracted, they call it. So then when the biopsy is done, I get them ready to go home, and I am the one who documents everything and then what we call tube the specimen to the pathology department to have everything slides and everything done on the specimen to find out if the patient has breast cancer or not. Breast cancer. Breast cancer develops in the ducts of our breast and also the lobules. The lobules are milk production glands. And in these ducts and in the glands, they can also form small masses, large masses that can also have abnormal cells. They can have cancer cells, and then that's how the patient has breast cancer, is that they develop these abnormal cells, and then they have to come to us to have a mammogram and ultrasound, and then to have a biopsy to make sure we know exactly what type of breast cancer they have. Men and women both can be diagnosed with breast cancer. Age is not a factor, and neither is gender. So breast cancer does not discriminate against anybody. It can be for anybody. The youngest that I have seen diagnosed with breast cancer is 17, and the oldest is 95. So as I said, nobody is discriminated against, unfortunately. The key to early detection is everything, so that mammogram yearly is very important. The earlier the breast cancer is diagnosed, the sooner treatment can be started. Once the diagnosis has been made, then they will go see a surgeon. The surgeon then goes through everything that they will need to do to have their cancer hopefully defeated, and they become a breast cancer survivor. And so when we say the steps that they'll need to do Surgery happens always. Chemo, radiation, and they find these things out knowing on exactly what type of breast cancer that the patient has. With the breast cancer, it is slow growing. Slow growing is a good thing, but that still really makes sure that you have that yearly mammogram. Yes, it's slow growing, but it's still very important. Early detection is everything. When you go to have your mammogram, the mammogram techs are going to ask you some information, and this information helps them find out if you are a high-risk candidate. A high-risk candidate is what you is somebody who has family history. So that is very important. It's something that you need to know. So your family history. So that was the first thing that when I started working at this office that I talked to my mom, talked with my family, and learned that, you know, my grandma had breast cancer. I didn't know that. So those things that you need to talk to your family and find out exactly who has family history, how old they were when they had cancer, and what type of cancer that they have. And they will put that all into their snazzy little computer system that they have, and that helps them calculate exactly if you're high risk or not. So those are always good things, and to have them yearly is always a good thing. And it's to keep asking family members, because it is amazing when you ask one family member and then another family member and somebody else knows something that the others didn't. They also ask if you've been on birth control and how many years you were on birth control. And if you weren't on birth control, if you have been on hormone replacement. So hormones that are added to the body can also cause cancer, so that's why they ask you that question. And also, how long you've been on it. That makes a big difference. Everybody has a different amount of time that they've been on birth control or they were on hormone replacement. When it comes to breast cancer, it does not necessarily need to be in your family history. So, yes, we've heard about family history, and you hear about BRCA1, BRCA2. Those are the genes that are passed along in your family. But that doesn't necessarily mean that, oh, well, I don't have that, I'm never going to have breast cancer. That's not true. Women who can have breast cancer, and the breast cancer is hormone related. Estrogen and progesterone, breast cancers can happen to everybody, and that is the most diagnosed cancer is the hormone breast cancer for women. And I can say that's what my aunt had. It was the hormone. So it can happen to anybody. It doesn't matter who you are. It does not pick, choose. It could be anybody. Could be your neighbor. Nobody knows. Self-breast exams. Those are another important thing that you need to do monthly. My office handed me this nice little sheet. Kind of shows you how to do your self-breast exam. And this way, if there is a mass, you can find it yourself. Get a hold of your primary care. And once you let the primary care, they know it's going on. They'll have you come in for an appointment. And then they will put in an order. And then you'll have a mammogram and ultrasound at a office, a women's center that does those. It's very important to make sure that you do these self-breast exams, find these things early. The earlier they're detected, the earlier you start treatment, and the sooner that you will be on your road to recovery and to being a survivor of breast cancer. I was discussing with my radiologist when I told her about the speech or my presentation that I needed to give, and we went over all my outline that I had, and she told me things that she thought I should keep and things that I should not keep. And the one thing she really wanted me to make sure that I talked about was having your yearly mammogram. And when you're premenopausal, in your 40s, so 40 is your first mammogram, that you need to make sure that you do those yearly and continue to do your monthly self-breast exam and do those yearly mammograms. Early detection is key to catching and becoming a survivor of breast cancer and beating the the disease. High risk. Women can be high risk. I talked about that a little bit earlier, and there are different things that make you high risk. I'm a high risk candidate. I have went to my nurse navigator in my office. We did a risk assessment. We went through my eating habits, my family members who had different cancers, how often I exercise, if I eat mostly vegetables, or if I eat a lot of red meat, or any of that kind of stuff. And I am overweight, so that put me in the high risk category. I have never had children. And I have family members who have had cancer. We don't know if they have the BRCA gene, but that is also puts me in the high risk category, is that I have family members, I am overweight, and I have had no children. So when you're overweight, the fat stores those hormones. When you have not had children, you do not have a break from hormones. And then when you have family members, that just helps you out a little bit to put you in that high risk category. I have met a patient this couple weeks ago, and she came in. We were discussing, the doctor came to see me, said she needed to come in right away. We couldn't wait any longer, so I went in, I scheduled her appointment. She continued to ask me if she could wait 5-10 years, because it had been 10 years since she had her mammogram, and she had been fine, so there'd be no problem. So no reason that she needed to have her biopsy right away. And so I said, no, the doctor came to visit me, talked to me before I came in to talk to you, and he said he wanted you in as soon as possible. So this is very important. He doesn't come to talk to me usually, so I know that he really wants you in right away. So it took a lot of talking with her and her daughter begging her to come in and get her biopsy. So we finally convinced her to come in to get her biopsy, and her results came back, and she was positive for breast cancer. So there's another story that tells you that early detection is a must, and that yearly mammogram and that monthly self breast exam, they're very important. They mean, if you do have breast cancer, getting your treatment right away. And you got to remember your loved ones, because this is hard on them too. So you need to make sure that you definitely get that yearly mammogram. My other story for you is that I had a 31-year-old come in about a couple months ago. She was pregnant, and she didn't think anything of it, because she thought, well, I'm pregnant. It's probably from all the hormones that are in my body because I'm pregnant. And, well, the mass had grown. So we had to do a biopsy. We did the biopsy. They sent that out. It came back positive. She is a mother of 2. And also we learned that the cancer wasn't only in her breast, it had spread in other parts of her body. So when you find something that is not normal for you, you need to make sure that you get a hold of your primary care doctor and you come in and get that mammogram and ultrasound so that you know exactly what you have going on. In our office, we give this book. Not easy to see there. Let's see. Which is Breast Cancer Treatment. And this is a wonderful book. They gave this to me right when I started in the office. And it explains all the different types of breast cancer, exactly how to talk to family members, to loved ones, to children. And those are hard people to tell. Oh, I just found out I have breast cancer. And that's very important that you tell your loved ones, because they are your support team, and you need a support team. And you have to remember that the office that diagnoses you also has support for you. Our nurse navigators always give out their phone number, their card, call them. They let everyone know that if they have any questions, they need any help, that will help them. But this book is a wonder. It does show you pictures exactly, the spots, the ducts that can cause the breast cancer, different things like that. There's another book that I found. It's from American Cancer Society, and this shows the different biopsies that we do, because we have 3 biopsies that we do, one under ultrasound, one under mammogram, and one under MRI. And this shows exactly kind of what we do and what they're about and how they're done. So this is a great book for you to take a look at because it also explains a lot of different cancers and things. So it's also not a bad thing. I'll get my finger out of the way.